Today's interview, I'm talking with Dr. Kami Haas of Super Dentist. Now, I'm really excited about this interview because I've been very, very curious about how dentists are operating or able to adapt during the pandemic. So, Dr. Haas, take it away and let me know what your company's been able to do.
Okay, well, good morning. How are you?
Good.
I hope you're safe and sound and healthy. So yeah, so it's kind of interesting. New York Times had an article a few weeks ago that said that dentists are probably at the most at-risk profession. You know, even higher nurses and many other professionals that we currently think they're at the highest amount of risk. Because obviously we're working in the mouth and we're working with saliva and we're working with aerosols and droplets and everything. So that's the bad news. The good news is this is something that we've had to deal with forever. You know, viruses and other pathogens and other bacteria and other viruses such as like HIV and hepatitis. So it's nothing new to the dental profession. So the good news is what we've done for the last few decades is really prepared us to be also doing the same things that we have been doing in the past, with maybe a few adjustments and a few additions to be prepared for this virus. So we can keep our patients, our staff, and our doctors safe.
And you have a couple of locations around San Diego. Are you keeping any of them open for emergency procedures or anything like that?
Yeah, so we're the largest pediatric group dental practice in San Diego. What I mean by the group is that we see almost 1/4 of all the kids in the county of San Diego. So we're a fairly large practice. We have over 20 doctors, and we see, in addition to pediatric dentistry, orthodontics, and the parents of the kids, you know, so we do some adult dentistry as long as they're parents. We call it parent dentistry. But because of that, we have offices all over the county, you know, from Chula Vista to our newest office in Escondido, which we barely opened before we had to shut it down, you know, temporarily, of course, because of the pandemic. And we're going to be opening it hopefully soon. I remember, you know, we went to the office March 13th, you know, that Friday. Everything was, by then in San Diego, I think, if I'm not mistaken, we had like 5 confirmed cases, so things didn't seem to be bad. But that's when things kind of fell off the cliff. As you can probably remember, everybody went through the same thing that weekend. Pretty much by Sunday, we internally decided to close our offices, and by Sunday evening, California Dental Association sent an urgent email to all the dentists in California recommending that offices close other than emergency cases. And then by the Monday, the day after that, American Dental Association sent an email to all the dentists in the country recommending that the offices close. And because dentistry, some things you know, cannot wait. You know, when you call emergency, you know, you need to be taking care of an infection, you know, bleeding, a tooth breaks, or something like that. And the last thing we want as professionals, as healthcare professionals, is to send those patients to emergency room. You know, statistically, every 14 minutes, a person walks in an emergency room because of a problem. And of course, during this pandemic, the last thing we want is because of those dental issues. So we want to take care of our patients. So we've been able to modify our hours and modify our locations. Like, for example, in our practice, we currently see patients for quote unquote emergency cases in one of our offices, the central office, which is Kearny Mesa. And we have some screening process in place to make sure that we screen the patients. And we only let patients in, you know, one at a time. We have some very, very good processes in place to make sure we keep the patients, the parents, really safe.
That's excellent. And for those who aren't coming in to see, you've actually set up like a virtual toolbox because you do see so many kids. And I've been to the Super Dentist and it's super fun. And even though I'm an adult, I feel like I'm a kid there, but you've also put some things online for the kids as well.
So we know dentistry in general, even before this pandemic, it's nothing usually people don't look forward to go to the dentist, right? You know, we can be honest with me. And so when we started our practice years ago, we started as a pediatric practice. And so knowing how critical oral hygiene and oral health is to someone's overall health, even currently is even more important. But because we knew that, and we knew that kids usually don't like to go to the dentist, we built our practice around what makes it fun for the kids, replicate our offices in people's homes. So of course, in our offices, you know, we have actually superheroes, and we have you know, dress-up areas and toy stores and video games, and it's a themed office. In our newest office in Escondido, for example, it's 2 floors, 2 levels, so we have a huge slide that goes between the 2 levels. But some of those we can't replicate in an office, but many of those things, luckily, because we of tech, we were able to replicate it. For example, because you can come to us, we literally can come to you through our augmented reality technology and experiences. So we have a dozen our augmented reality experiences, and we publish those all on our virtual super lounge page on our website. And the way that works is you have our app and you print those, or you kind of have it on an iPad or a screen, and then using your phone or another tablet, we come to life in 3D in many different characters, and we provide all sorts of education and entertainment wrapped together. That's what we do best at Super Dentist. We educate the public, we educate the kids, we educate the teens, we educate the parents, but we do it in a fun ways. Nobody wants something that's boring, and dentistry, it's usually not on top of people's list as far as the fun things. But so these experiences are just phenomenal, and they're not just like your, a very Pixar, Disney quality. So we, for example, in the toothbrushing area, you can either buy one of our super toothbrushes from Amazon and get it delivered to you right now, that this technology comes with it, or to make it easy for free, you can actually download that image that comes with the toothbrush. We now have it provided on our website, and then you post it to your bathroom mirror. And our tooth fairy, one of our characters, will just jump out of the image in your bathroom in 3D and teach the kids how to brush and floss correctly. We have our own Super Dentist music that you can either play Apple Music or Spotify or YouTube, all sorts of available online sources. It's called We Love the Super Dentist. You can sing along. It's a 2-minute version of it. It's perfect for toothbrushing. I've been home the last few weeks, so obviously I've been writing new music for the Super Dentist and all sorts of fun stuff. So that virtual Super Lounge is a wonderful resource for parents and fun. In addition to that, we have a bunch of our movies. We have Super Dentist movies with superheroes and villains. And again, all sorts of things that we have there. It's all education for parents, but it's really entertainment for kids. So as they're watching these things and they're interacting with them in the coloring books and everything, they're learning about things in a fun way. So I encourage everybody to visit those pages.
Now, is that open to anyone? I know you already treat about 1/4 of the kids here in San Diego County, but if someone who doesn't typically go to Super Dentist were to go to that on your website, could they also interact with it?
Absolutely. We are part of the community. It doesn't matter if you're a patient or not. We want to make sure that we help. Everybody's been trying to help everybody else. And I think that's one of the best things that came out of this pandemic, was that we all realized that it doesn't matter if you're a Republican or Democrat or immigrant, you live here, it doesn't matter what, we're all in it together. This virus doesn't know, where you're from or what you do. One lucky thing though, I gotta say about this virus, if I can say, out of all this mess and this craziness and this unfortunate events that we've had, is the fact that kids in general have been more protected than the rest of the age groups. Just in California, for example, only less than 2% of the infected kids in the population of COVID-19 have been under 18. I think the number is about 1.7%. And out of those, only a very small percentage have been, needed severe things or been hospitalized. So at least I can say, as a parent, I feel very lucky that this virus does make an exception, and those are the kids in general.
Yeah, it's been very interesting to watch kind of how it's affected different parts of the population and why. And I wanted to ask you, during this pandemic, while we're dealing with COVID-19, from your perspective, what is the most important thing for oral health that people need to pay attention to, especially as they're not going in for their regular checkups and seeing their dentist?
If I had to give you some pointers, obviously brushing and flossing is always the best thing. Going back to the nursing homes, I probably be a couple more pieces of advice for the elderly population that are in those areas, is if they don't have access, because for example, there were some studies a few years ago that showed that in nursing home, patients with better oral hygiene have less risk of pneumonia and complications with it. Or there was a study in Spain that shows that if you just saw a dentist in the previous month, again, you have low risk of these issues. So, but obviously dental offices are closed across the country. It's hard to get access to dental care. So meanwhile, a couple additional suggestions to patients who have difficulty with brushing and flossing, either with dexterity issues or alike. is they could, if they have, for example, if they have dentures, either removable dentures, partial or full, they should remove it before going to bed, before sleeping, because the bacteria and the plaque and the pathogens that are stuck to those devices can fall off of it, and they could be aspirated, during sleep. So that's one additional tip. Another thing is those patients who have, again, difficulty with oral hygiene, they can order particular mouth rinses like chlorhexidine mouth rinse or hydrogen peroxide, and that reduces the volume of microbes in their mouth. And those can be ordered online and could be delivered to them. So those are some additional tips for the elderly population, especially in the nursing homes.
One final question for you. As we're coming out of the pandemic, the dentist office, they have to open. Eventually, your offices will open. What does that process look like for you?
There's going to be some additional things that we should do. For example, obviously, all the social distancing efforts and protocols should follow, which means fewer patients in the reception rooms. Everything that can be done digitally can be done. The forms should be done before the appointments. The number of kids that need to come with the parents should be reduced. The number of patients. The dentist, if they're going to do any procedure that's going to create aerosols, like if they're going to use a handpiece, those should be done in separate rooms. And obviously a lot of dentists be using technologies that clean the rooms more effectively. So there are a few things that I think dentists should do, and we're going to doing to make sure that we have additional protocols in place. But the good news is the dentists in general, our profession has been faced pathogens before, and so we're kind of like have a lot of good protocols in place already for those.
While I have you here, is there anything else that you want to add or say or talk about that we haven't touched on?
I guess, one other thing I just wanted to kind of add about the whole state right now and oral hygiene. I'm a parent again, and one of the things I've had to do, and my wife and I had to adjust, is now we're teachers too, part-time teachers. I think the teachers doing an amazing job as much as possible to go online and have everything virtually. But I think our kids' oral health can even impact their education. Generally speaking, before this pandemic, 51 million hours of school was missed annually because of infections and dental pains. And that's a lot of numbers when you think about it. There have been many studies that link poor oral health and dental pain to, getting C's, getting bad grades, and all of those things. Just because when you think about it, if you had a dental pain, if you had a toothache, could you sit in and concentrate on learning, math and science? Of course not, right? And when we have dental pain, we can't eat hard to eat, healthy foods like vegetables and fruits that can impact our nutrition. And so there's just so many aspects when it comes to oral health. So I really encourage parents to make sure that as they're doing everything else that they're doing these days, to really be a super parent and be a super teacher and a super person and a super husband and a super wife, to really take oral hygiene very seriously and make sure the kids don't lose those routines, which is so critical for kids these days because they don't have those routines in school. So this is one thing that they can do to keep that routine going and keep the kids healthy and safe until we get back to our offices.
And then I just kind of have an aside question for kind of our underserved communities and communities that may be suffering a lot more during the pandemic. Are there any resources that you know about where they could reach out if they need to get a toothbrush or floss for their kids or things like that?
We've actually been donating lots of toothbrushes and flosses to all sorts of organizations throughout this pandemic. And so I know, for example, the San Diego Dental Society has a bunch to give out. We at our office will be happy to give it out if I know this virus has disproportionately affected underserved families, and the lower income families, particular ethnicities. And so we want to do everything we can to help. So if people need, brushes, flosses, any oral care product, we'll be happy to give those out at any of our offices when we open, but currently at our Kearney Mesa office on Arrow Drive.
Dr. Haas, thank you so much for your time. This was great.
Thank you so much. I'm so happy that we had a chance to talk and looking forward to connecting with you at some other point, hopefully under better circumstances.